Thank you, Speaker. Colleagues, I know the hour is late, but this is a really important study which shines the light on a particularly dark place, suicides. Before I give you the substance of the findings of our report, please let me take a minute to thank all the witnesses who shared their lived and living experience on suicide with us. Stigma around suicide and mental health persists, and without discussing these topics, there is little hope for improvement. I would like, in particular, to thank our colleagues, Senator Stan Kutcher and Senator Patrick Brazeau, for their insight and perspectives on our study. The Senate Standing Committee on Social Affairs, Science and Technology began its study on the Federal Framework for Suicide Prevention in September 2022, holding 5 meetings of testimony and hearing from 23 witnesses. The Federal Framework for Suicide Prevention was published in 2016 after a period of consultation following the adoption in 2012 of the Federal Framework of Suicide Prevention Act. While the framework establishes an idealistic vision of a Canada where suicide is prevented and everyone lives with hope and resilience, the committee heard that there has been little change to the overall Canadian suicide rate since its implementation. In fact, the overall annual rate has remained largely steady for the past 2 decades, fluctuating between 11 in 100,000 to 12 in 100,000. So the committee asked the question, where are we after 7 years? The title of our report is Doing What Works. It could easily have been called Doing What Doesn't Work, because the Federal Framework for Suicide Prevention is failing by the only metric that really counts: lives saved. Since the framework was established, the suicide rate in Canada has not meaningfully changed. There was the slightest of decreases in 2020, which witnesses attributed to pandemic-related supports. But it has otherwise remained stubbornly steady, and we wanted to know why. One cannot fault the framework for not having lofty ideals and aspirations, laudable language, and praiseworthy goals. It aims to prevent suicide through partnership, collaboration, and innovation. It aims to do so while respecting the diversity of cultures and communities that are touched by this issue. It speaks of building hope and resilience and leveraging partnerships. All of this is, as we found, heartwarming, inspiring, but ultimately ineffectual. The evidence, as we heard, is that fine words have no effect on health outcomes for people in crisis. The committee makes 10 recommendations, and I will not go through all 10 of them. I will simply highlight 4 in the hope that you will turn your attention to this report. First, we need to go where the problem actually is. It is not in the general population, but rather in specific sections of it, primarily men and boys who are First Nation, Métis, and Inuit. Senator Brazeau was particularly compelling as a witness on this point. Second, we need to invest in programming that works, backed by evidence that it works, not touchy-feely good ideas or best practices. Senator Kutcher has emphasized the need to review the efficacy and impact of revenue-generating programs for suicide prevention. Third, we need to focus on means intervention, which in simple words means that we need to restrict easy access to those methods of suicide which may make it easier to succeed, such as barriers to bridges, easy access to medication, etc. Fourth, and significantly, we need to aggressively collect data and disaggregate it to follow the evidence. In short, doing what works as opposed to spinning windmills in the air is what is important. This is about lives and saving them. And this report puts out significant recommendations which could do so, particularly in light of the fact that the Federal suicide prevention framework is due to be reviewed. Thank you, colleagues.
Thank you.